Gambia receives another set of medical supply in the fight against COVID-19 pandemic. Africa CDC intensifies efforts to tackle the COVID-19 pandemic in the continent. Ghanaian government commits funding for COVID-19 affected businesses. These and more coming on the World Today. Do stay tuned. Hello, you're watching the World Today News Bulletin on iAfrica TV, and I am Julden Jai. Now to the news in detail. In a bid to help Gambia in the fight against the global pandemic, West African Health Organization donated medical equipment to the Gambia. The government continues to receive donated aid from international organizations to fight against the global pandemic in the country. More of that in this report.
As medical assistance for the Gambia continues to arrive at the country's airport, the newest cargo is the one from the West African Health Organization. The substantial medical equipment from the regional bloc was escorted by the health organization's director, Stanley Okolo, geared towards helping member states in the fight against the global pandemic.
The second aspect of how we are supporting in terms of fighting this pandemic is what you see today. How we are making sure that we bring in materials, bring in equipment, bring in things to support the country's efforts.
On the aspect of what a member state gets from the package, Director Okolo said it is measured to the number of COVID-19 cases and the population of a country.
All 15 countries of ECOWAS are benefiting from this. And the first batch of goods that we have purchased is about $8 million. And that is going to all 15 countries of ECOWAS. And in terms of proportion, we are spreading this to ensure that countries receive the goods based on the number of COVID-19 cases they have and the number of the population that they have. Those two things contribute to determine the number of equipment they get.
The ECOWAS Special Representative Vaba Gayflaw expressed her sincere gratitude to the donor, saying it is a timely intervention.
That this is coming at this time, because right now in the Gambia we are facing a lot of crisis. Yes, there has been a sudden surge. Everybody was relaxed, but we are very, very pleased that this intervention is coming at this very timely moment.
Gambia's Foreign Affairs Minister Momodu Tangara received the package on behalf of his cabinet colleague, Minister for Health, who is currently under quarantine, has this to say.
This COVID pandemic has proven to all of us that the world is a global village. What affects one directly affects all of us, and we are in the fight together. And we are grateful that ECOWAS once again has demonstrated its commitment to serving the people of the region.
The Gambia continues to battle with the pandemic as surge in the number of cases reached 935, 16 deaths and 136 recoveries since the pandemic first case in the country 5 months ago. For iAfrica TV, Fatmata Fati.
South Sudan's oil production has been badly affected due to the impact of COVID-19 global pandemic. The country's development programs is also drilled as the government struggles to get foreign currency to manage the situation. As the world oil prices continue to drop, authorities are devising means to improve the economy. Detail of that in this report.
COVID-19 restrictions are disrupting the flow of oil production in South Sudan. The closure of seaports in neighboring Sudan has negatively affected means of reaching international markets, and limited transport has created issues getting hold of necessary chemicals.
The prices of oil really went down so much that it was not really earning us enough foreign currency for the nation to be able to do whatever they want to do.
oil money funds 98% of South Sudan's budget, it has been bringing much needed foreign currency into South Sudan. But business people here now say hard currency is scarce, the local currency is losing value and prices of goods are rising, and it is having effects on shopkeepers.
Customers are coming just a little in a day. You can't get even much. In the shop, both business, mobile money, and the shop. That is the only challenges we are facing. We get now a little few sales in a day.
South Sudan is among the most oil-dependent countries in the globe, according to the World Bank. So the government is trying to encourage production in other areas of the economy. South Sudan's economy is characterized by subsistence farming and pastoralism. Most of the commodities in the markets are imported, and that creates more demand on the hard currency, which is currently not readily available. South Sudan's government is saying it is starting to buy locally mined gold with the intention to purify it and build a durable reserve.
Should we have enough foreign currency from the gold that we have, that means we will stabilize the market. When we stabilize the market, the prices will come down. When the prices will come down, even the exchange rates definitely will come down.
The COVID-19 pandemic has derailed South Sudan's plans to increase its crude oil production. It is now revising its plans in the hopes of an economic revival elsewhere.
COVID-19 cases in the Gambia are increasing at an alarming rate. Since Monday, the country registered over 100 cases daily. Journalists who are expected to be reporting on COVID-19 situation are also contracting the virus. In the past 2 weeks, more and more journalists are testing positive. Louis S.A. Alsan, commonly known as Tina, is one of those to have tested positive recently. Tina has since been taking treatment at a local hotel. She joins us live to share her experience. Ms. Alsan, can you tell us when you knew that you had the virus?
Yes, thank you very much, Rebecca. I was called and received a call on the 30th of July that I contracted the virus. So I received a call in the morning and later in the found by the health workers at the Ministry of Health.
Okay, you waited for a number of hours, or let's say days. How do you feel knowing that you don't know your status and waiting to know your status?
Yeah, I waited almost 60 hours before I knew my results, because I was told it would take 48 hours. So that day the Wednesday, I didn't receive a call. So I was going to an extent of perceiving that I am negative, but I was still going to be careful. So the next morning, I was so anxious, I was nervous. Even to sleep those days was fine. I was wondering what my results would be like.
Very well. How do you know when you know that you are tested positive for COVID-19?
Well, because I was exposed, so because of the exposure that I had and people who were among them positive, I said, let me test and know my status better than waiting to show symptoms or risking or being infected and going along transmitting it in town.
And how does that really make you feel?
I didn't get that clear.
I mean, how does that make you feel knowing that you are COVID-19 positive?
Well, I feel, well, at the beginning I was shocked. It was hard for me to believe that I contracted it, knowing the day I felt I was exposed. I felt I was well sanitized and wearing my mask. So I felt I need to be normal so that I can fight it. Though I developed some symptoms later, I was confirmed. But thanks be to God, I was able to overcome. I was taking medicines, and now you can say I'm speaking clearly and fine. No more depression, no more sore throat.
Very well. How does even your family and friends, relatives and loved ones react to the news of hearing that you're positive of COVID-19?
Yeah, that was the hardest part, the most challenging part in my own case, because it was very hard for them to accept and believe. Although it went to a certain point because of stigmatization, fear of stigmatization. Well, my family, my friends wanted to actually, but I feel that wasn't the right thing to do. And I knew that I came in contact with so many people. I needed to enlighten them. I needed to inform them because I sent messages. They didn't believe that I could contact.
All right. What type of treatment have you been undergoing?
So sorry for that. The network is poor. So that led me into making a video so that they will.
I mean, when do you know that you are positive? What treatment have you been undergoing?
Well, fortunately, the day I received the call in the morning that I was positive, I had some contact, so I called some people that I know that are working with this COVID-19 people. So I asked what medicine they were using. So I bought vitamin C, zinc 10, and another medicine, but I just didn't take them directly, because I knew that the response team wouldn't come immediately. So I just wanted to take some medicine before I started having, my reaction started going out of hand. So I drank the vitamin C. I'm waiting for them. So when I was brought here at the treatment center, I showed the doctor the medicine that I bought. So he said, based on my symptoms, the symptoms that I begin to show, he said it was okay for me to drink this medicine. So those are the medicine I've been drinking lately.
So how are you treated at the treatment center, considering the fact that many people have complained of poor conditions?
Yeah, honestly, the facilities here, the way we're treated here, it's not good. And the Ministry of Health, it's true, maybe one could say, because they lack personnel, that is why they couldn't be here every day to check on us, because some people can develop symptoms, because most of us here didn't had any symptoms the time we test, but they develop symptoms at the latter part. So they are not here to check on us every day. The food we're eating, it's not balanced diet, which we feel is not going to help us. So, but it's really sad that you even need assistance, you will need some help. You won't have someone to help you out.
So how many Gambians are of course in denial that the COVID-19 exists? What is your message to them?
Well, my message to them is that the COVID-19 is real. The COVID-19 is real. Let them not wait until they develop symptoms, or wait until their family member suffers because of the virus, or their family member lose their life for them to believe. Let them believe that COVID exists. We wouldn't be here. Countries will not be stopped. Business will not be stopped for nothing, for a joke. So let them know that the virus is real.
All right, finally, as a journalist who contracted the virus in your line of duty, what do you think the government's approach should be in the fight against COVID-19?
Well, the government already had a gap. We all have seen the gap. Right now, there's nothing I can tell the government. I'm just appealing to people and my fellow colleagues to take good care of themselves, to stay safe. I know everyone is not safe here, but I believe if we treat everyone around us as infected persons, we will be able to solve the situation.
All right, thank you very much, Louise Alsan, and we wish you a very speedy recovery.
Thank you very much, Juldenjai.
Thank you. All right, we move on to other issues. As the continent registered more and more COVID-19 cases and related deaths, Africa's Center for Disease Control and Prevention gave an update on the numerous initiatives they have implemented to fight against the spread of COVID-19 in African regions. This includes the processing of traditional medicine for COVID-19 cure. More of that in this report.
With more than 600,000 cases of COVID-19 in Africa, the Africa Center for Disease Control and Prevention is working in search of a COVID-19 vaccine for the continent. Recently, the continent registered 992,710 cases of COVID-19, with 21,617 deaths and 673,757 recoveries. The director of Africa Center for Disease Control, Dr. John Kengasho, in a weekly press briefing said Africa has a fatality rate of about 2.3% after a test conducted on millions of Africans in different parts of the region. Dr. Kengasho said a series of their vaccines are going under medical trials in some African countries, saying he is hopeful that the outcome will be promising. He said sub-associations are also launched to look into the affairs of the traditional medicine that will also undergo testing. He said this is all geared towards providing a lasting solution to COVID-19. As the number of COVID-19 cases take multiple dimensions, Africa CDC has also been conducting a series of capacity-building programs for its member states in response to the fight against COVID-19. For iAfrica TV News, our Makalu.
That report by our Makalo will take us to our first break. Do stay tuned. We'll be right back.
Debunking COVID-19 myths. Myth 1.
I'm not scared of COVID-19. Africans cannot contract the virus.
COVID-19 can affect anyone of any race, nationality or skin color, as we have seen in many African countries, including the Gambia.
Myth 2.
Is it true eating garlic can help you prevent getting COVID-19?
No, there is no evidence for that. Keep washing your hands. Maintain at least 1 meter physical distance from others and use the preventive measures to protect yourself and the people you love.
Myth 3.
Hey, did you know that Gambia is spared? COVID-19 cannot survive in hot climates.
Actually, COVID-19 survives in all climates, hot or cold. Look at our neighboring country. We have to continue washing our hands and avoid touching our eyes, nose, and mouth.
Myth 4.
COVID-19 that only affects the urban areas. We are not affected here in the rural areas.
No, not all cases are in the combos. There are confirmed COVID-19 cases in other regions of the Gambia.
Gambian leader President Adama Barrow declared a state of emergency on Wednesday, which seeks, among other issues, to shut down the country's borders and airspace due to the increase in the number of COVID-19 cases in the country. The country has seen recent spike in the number of COVID-19 cases since end of July. Detail of that by Ndei Sise.
The Gambia recorded an additional 136 new cases, making it the highest reported in a single day, bringing the total number of COVID-19 cases ever confirmed in the country to 935 and 21 new recoveries. According to the 112 national report issued on Tuesday, about 30% of the confirmed cases are health workers from Bundum Maternal and Cal Health Hospital and the Kanifing General Hospital. The report indicated that, unlike the previous set of cases reported at the beginning, over 50% of the new cases are symptomatic. By the latest report, the country recorded 21 new recoveries, bringing the total number of recoveries to 129. 375 new laboratory test results received, out of which 213 tested negative of the virus. 20 people newly taken into quarantine and 94 people were discharged. The country currently has 456 people in quarantine, 777 active cases, 92 probable cases, and accrued case fatality ratio of 1.7%. In the wake of the worrisome trajectory of the COVID-19 pandemic in the Gambia, President Adama Barrow has on Wednesday declared a state of emergency, shutting the country's borders and airspace. In the same vein, Barrow, in the powers vested on him under Section 34, subsection 1A, and pursuant to Section 34, subsection 2 of the 1997 Constitution, imposed a curfew starting tonight from 10 p.m. to 5 a.m., lasting for 21 days. All houses of worship, educational institutions, and all non-food outlets in all markets throughout the country shall remain closed during the course of the emergency and curfew period. The statement stated the only person on official COVID-19 duties, ambulances, and public officials on essential assignments are exempted from the curfew. The statement further stated that those found violating the curfew commits an offense and is liable to a fine of $5,000. COVID-19 cases in the Gambia have surged over 60% in the latest 7 days to nearly 800. Since early July, over 40 healthcare workers in the Gambia have tested positive for COVID-19, weakening the country's response efforts. The virus did not spare the cabinet ministers, as 5, including Vice President, tested positive for the virus. The Minister for Women's Affairs, Children and Social Welfare, Fatou Kinte, is the latest minister to test positive for the virus. For iAfrica News, I am Daisy.
The report by Ndai Sise takes us to Nigeria. One of Nigeria's major cities, Lagos, has shut down 2 more isolation centers as the number of COVID-19 cases continue to drop. The Nigerian government introduced home care management for low-risk patients for cost-effective and further eased emergency restrictions with the reopening of learning and worshiping places. But this latest move did not go down well with other residents. More of that in this report.
The Lagos State government's decision to shut down 2 more isolation centers comes just weeks after the first one was closed. But it's not just the decline of new coronavirus cases that is prompting this move. Since the government announced it was starting home care management of COVID-19 cases, the number of patients at its isolation centers have dropped off, with many patients preferring to be treated at home rather than at designated isolation facilities. The state government says just under 100 patients have been treated at its isolation centers at the moment, while about 1,800 are getting treatment from their homes.
So we've got it to a stage where we need to be able to also be able to balance the economics of it, and which of these facilities do we need to keep running. Some of them now are having less than 20% occupancy. And we've seen over time that we can very quickly also wrap up those capacity again.
Treatment for COVID-19 is free in Lagos. Instead, the cost is incurred by the state, but the cost could go as high as $25,000 per day for a severely ill patient that needs intensive care. And it's part of the reasons the government introduced home care management for low-risk patients.
We have seen a gradual decrease in positivity rate in Lagos State over the last 2 weeks, which combined with our increase in testing numbers points to a very encouraging picture of the outcome of our response strategy in the states.
Buoyed by the city's declining number of COVID-19 cases, authorities have now announced a further easing of restrictions. Schools are allowed partial reopening for students sitting final exams. Worship places can resume services, with some exceptions, while restaurants will be allowed dine-in services. But some health experts are warning against rushing to ease restrictions.
We may not be having a high number of cases like we were having before, but then again, it's all boils down on the number of people we are testing, the number of people that are coming forward to be tested. Before, in the past, a lot of people were coming forward to be tested, but now I doubt we still have that kind of zeal.
One step at a time. That's how the government in Lagos says it is approaching this.
And despite the lockdown easing, it is also advising residents not to let down their guards, warning that the fight against COVID-19 is very much far from won.
The Gambia Armed Forces has joined in the call for citizens to follow state of public emergency regulations. This came after the announcement of a new emergency regulations and curfew by the Gambia government. In a release issued by the Ministry of Defense, the Armed Forces say they are committed to supporting civilian authorities respond to the COVID-19 crisis. The Gambia Armed Forces assured the public that their soldiers are well trained and will be able to do their work in the best interest of the public. Ghanaian's government is providing more than $300 million relief support for affected businesses amidst the impact of COVID-19 global pandemic. Businesses are likely affected thanks to the global crisis, resulting in many workers losing their jobs. More of that in this report.
Anayebue's work at this salon suffered a setback when Ghana went into lockdown in March due to the coronavirus outbreak. Her only source of livelihood was on the line when she closed her salon to customers.
People come to do their hairs, pay us and all that so that we can get a little bit of money for ourselves. But since we were not working, we had no money on us and all that.
As the government lifts restrictions, businesses like Anna's have begun to open, but it will take some time for them to recoup their losses. Official statistics show 42,000 employees were laid off during the lockdown, and the impact of COVID-19 on businesses still lingers. Anna's salon can, however, enjoy the free water supply for the next 3 months and free electricity for the rest of the year. It's part of the government's relief to citizens and businesses impacted by the pandemic.
Now that we have free water, free electricity, we want a constant supply so that it will help us flow in our business.
The government has also set up a $347 million fund to support all sectors of business and create jobs. The government says this intervention could support economic growth after the shocks caused by COVID-19.
As the government tries to stimulate economic growth with the relief packages to citizens, it is also looking to slash capital expenditure by $216 million. It hasn't specified where the cuts will come from, but some economists worry it could affect plans to invest heavily in infrastructure this year.
Already, the government spending has gone up due to the unbudgeted COVID-19 containment measures. Meanwhile, revenue generation has fallen below target due to the slump in crude oil prices, among other factors, as a result of the pandemic.
Our trend in terms of capital expenditure as a percentage of GDP is actually on a decline. That actually gives an indication that we are more or less trying to stimulate growth and then minimize the impact of COVID-19. But the other aspect is trying to get ourselves out of the lower middle income economy. Yeah. So that's where we have to do more.
Businesses like this salon are doing all they can to bounce back from the hardship caused by COVID-19. Although the government's relief could boost their efforts, economists say it is only a short-term solution of dealing with the impact caused by the pandemic.
This is the end of the World Today News Bulletin. For more of these and other stories, log on to iafrica.tv. Thanks for the pleasure of your company and do have a pleasant evening. Bye-bye. Once again, I am Julden Jaisware.